Good evening, everybody. This is Dr. Stephanie, your double board certified critical care physician who works with physicians who are struggling with their jobs, burnt out with their careers, or who just want some career advice. Through my books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so that they can practice medicine on their own terms. Happy National Women Physicians Day. We are here to celebrate National Women Physicians Day, and this is number 3 in our Facebook Live series talking about women in medicine. Tonight, we are going to talk about women physicians and burnout. But before we get started, I have a couple of requests. If you're watching this live, just let me know where you're watching me from. If you like a comment, please press the like button. If you love it, press the love button. If you are watching this on replay, please type replay in the comments. I really appreciate that. So tonight we're going to take a couple of minutes and talk about women physicians and burnout. Burnout among physicians is a hot topic. Burnout amongst women physicians is an even hotter topic because this is an issue that affects the physician workforce and it affects the public health of the American citizens. We're already in a situation in which there's a shortage of residency trained physicians. There's a severe shortage of physicians in underserved areas. So if you have situations in which physicians who are currently working are at risk of burnout, that causes a huge problem. So we're going to take some minutes to talk about women physicians and burnout. And when in doing the research for this topic, I came across the Medscape National Physician Burnout and Depression Report, which is a very recent publication, and it had some very interesting data that came about as a survey of from tens of thousands of physicians. Now, it is no surprise that about 42% of all physicians are burnt out, with about 15% of physicians reporting clinical depression. So that's really big. So almost half of physicians surveyed report signs and symptoms of clinical burnout. The rates of burnout do differ per specialty, and this is something that's near and dear to my heart because of the physicians surveyed. Critical care medicine doctors like myself, intensivists, have the highest rate of burnout. Our burnout rate, the 48% of intensivists surveyed reported burnout, and that hits home to me because, like I said, I am a critical care physician. And I do remember when I decided to go into critical care and to be an intensivist, some of my attendings warned me. They said, listen, you need to find something else to do in addition to critical care because the burnout rate is high. And I can say that I have experienced burnout, and that is one of the reasons why I do what I do, which is locums, and we'll talk about that later. So 48% of critical care doctors reported burnout, 48% of neurologists reported burnout, 47% of family practice doctors, 46% of OBGYN and internal medicine doctors reported burnout. Emergency medicine and radiology, 45% of those doctors reported burnout. Now, not surprisingly, the rates of burnout are lowest in plastic surgery, dermatology, pathology, and ophthalmology. And these are subspecialties that have very little coverage in emergent situations. So, your plastics guys, your dermatology, pathology, and ophthalmology physicians reported the lowest rates of burnout. So, physicians reporting the burnout and depression, OBGYN, 20%, public health physicians, 18%, and urology and neurology, 17%. But it's not surprising that more women physicians are burnt out in comparison as opposed to their male counterparts. 48% of women report burnout versus 38% of men reporting burnout. And burnout varies with age. So your 28 to 34-year-old, 35% of those physicians reported burnout. 50% of physicians 45 to 54 years old reported burnout, and 41% of physicians 55 to 69 years old reported burnout. So it tends to, increase and then decrease. And I don't really know what the reason for that is, but maybe the 45 to 55-year-old age range is more along the lines of people who are really busy in the throes of raising their kids. They're knee deep into their careers, and the work-life balance, career issues, financial issues probably reach their peak at the 45 to 55-year-old age bracket. Burnout is equal between employed and self-employed physicians. So, sometimes you have doctors who are employed and they say, you know what, I just can't take this anymore. I can't take the politics anymore. I want to go work for myself. And then you have the self-employed physicians who are dealing with the issues of running a business. So, it's kind of pick your poison, because according to the results of this survey, burnout is equal regardless of whether you work for somebody or work for yourself. So the top 3 causes of physician burnout: job, family, and finances. Makes perfect sense. Your job's stressing you out, you have financial challenges, and you've got a family, you've got to balance, job, finances, and family. So those are the top 3 causes of burnout. Now, the effects of burnout include burnout affects your interactions with your patients. Sometimes you're just less engaged, and in fact, it affects your interaction with your staff and your colleagues. Sometimes your performance suffers. You might be a little more prone to errors. Sometimes, you may be a little more prone to being tardy. Those are just some of the effects of being burnt out. Now, some of the top contributing factors, the physicians in this survey, 56% of them said one of their top causes of burnout is too many bureaucratic tasks. Just the forms and the pre-authorizations and, the EHR and the documentation and the paperwork is endless, and that is a contributing factor to burnout. 56% of physicians surveyed said that it was the number one factor. Too many hours at work. A lot of us doctors just work too much, and sometimes it just gets to be too much. So too many hours of work. Lack of respect from employers, administration, staff, and colleagues. This is huge, and this is especially huge for women because, as I talked about 2 nights ago, women physicians experience more disrespect than their male colleagues. Women physicians are less likely to be referred to as doctor. Women physicians of color are not only more likely to be not referred to as doctor, but we are also more likely to be mistaken as members of the ancillary staff. That is a huge problem. Lack of respect from administration. I once worked in a hospital as an intensivist in a 24-bed ICU that was really busy, and the CEO basically told me that his job was more stressful than mine. And I'm like, I'm thinking to myself, dude, you sit in meetings all day. I save lives all day. I deal with critically ill people all day. And that just showed me that he had no idea what we do every single day in caring for patients in his facility. So needless to say, I no longer work for that facility. So lack of respect is a contributing factor for physician burnout. A lot of physicians, about 24% of the physicians surveyed in this Medscape survey, said that electronic health records are a source of burnout for them. And a lot of people will tell you that physicians who are close to retiring will actually retire before they have to learn a new EMR system, because it's just too much stress for them, and they're just not really trying to have that. Lack of control and autonomy. People who have no idea of what you do are trying to tell you how to do it. And then they look surprised when 6 months down the line, what you said was right, but they don't want to admit it. So this lack of control, lack of autonomy, emphasis of profits over patients is a huge problem. And then another problem that contributes to burnout amongst physicians is this whole maintenance of certification mess. We can have a whole different discussion about that, but those are some of the top contributing factors. Like I said, too many bureaucratic tasks, too many hours at work, lack of respect, electronic health records, lack of control, lack of autonomy, emphasis of profits over patients, maintenance of certification. Those are all things that really cause physicians to be burnt out. Now, the physicians in this survey also were asked what would make burnout less, what could help their burnout. And they listed things like increased financial compensation. You have to realize that a lot of things physicians do are uncompensated. For example, a lot of physicians have to spend hours after work completing their charts, the electronic health records, and a lot of physicians take this home. So they're still doing work when they're not at work. However, that time is not compensated. So instead of an 8-hour day, your day ends up being 9 or 10 hours because you've got to complete the administrative task before the end of the day. A lot of physicians are not paid to be on call. A lot of physicians are asked to serve on committees, and that time is uncompensated. So, increased compensation in terms of actually being paid for the time that we work or do work-related activities would really help in burnout. A lot of physicians said that one way for them to decrease burnout is to have a more manageable schedule, meaning that they need to have control over their schedule instead of just being told when to work and where to work and how to work. We need to have some say into that. Less regulations would help as well too. More manageable patient loads. I mean, I know of family practice doctors who are seeing 30 patients in the office a day. And, I know of other physician specialties that see way more. And I'm sure with cold and flu season in full effect, the patient loads are just almost unbearable. Increased autonomy would help as well too. Like I said, you have people who have never laid eyes or hands on a patient telling us how to care for patients, and we just need to get the autonomy back. So that would help prevent and decrease burnout. Increased respect across the board. It seems like a lot of times people respect Dr. Google more than they respect the physician that is sitting across from them that has spent countless years of their lives in training. And in terms of women, respect is a huge thing because, like I said, women are treated with less respect than men are, and we have the studies to prove that. Let's see. So yeah, increased respect. Like I said, increased scheduling flexibility would be something that most physicians would love to have, just to regain that control over their schedule. And we all are frustrated with this whole corporate takeover of medicine, so to speak, in which it seems like profits are placed over patients. And we physicians want it to change, in which patient care comes first. And if we get back to a situation in which patient care trumps everything else, then that would give us back a sense of, well-being, and would decrease burnout rate amongst physicians as well too, because we want to know that we will be not punished for doing what's right for our patients. Now, what are some of the ways physicians cope with burnout? Exercise. About 50% of the physicians surveyed stated that they exercise. I exercise. Y'all know I am in love with my Peloton bike, and I also have some wonderful trainers. So I make sure that I schedule exercise in every day, and I make sure I invest in trainers to keep me accountable. Talking with others helps as well too. About 46% of the people, the physician surveyed, stated that they dealt with burnout by talking with people. And that is the great thing about social media, is because now there's so many Facebook groups and social media groups for physicians that are really designed to be support groups. We have support groups like my Creating Careers in Medicine Facebook group that helps doctors explore non-traditional ways of working and practicing medicine. There are groups for physicians who are looking for non-clinical things in medicine. There are groups that are support groups for physicians who are burnt out or are struggling with burnout. And that helps, because oftentimes this isolation and feeling like you are the only one that's going through something really kind of exacerbates the symptoms. And talking with other people, reaching out, really helps to know that that you are not alone. But the other coping mechanism is sleep, something that I love to do. So 42% of the people, the physicians in this survey, stated that they coped with burnout by sleeping. Yes, I cannot emphasize enough the importance of getting adequate rest. 36% of the physicians surveyed stated that they coped with burnout by isolating themselves. I kind of wouldn't recommend that because reaching out and being amongst other people help. 36% of the physicians listen to music. 33% of physicians indulge in junk food in order to cope with burnout. And I hope my trainer, Paulette, is not watching, but we do. I used to have a bad problem with Doritos and Twizzlers after a really bad day at work. So, junk food sometimes can be our friend, and I understand that. 22% of the physicians surveyed stated that they coped with burnout by drinking. What can I say about that? Binge eating is also a way that physicians cope with burnout as well. So, some of the coping mechanisms are healthy, some of them are not healthy, but what do we say? It is what it is. Now, how do the coping mechanisms with burnout vary with gender? Now, it's not surprising that women physicians are more likely to talk about their burnout because women, we just talk more, we're a little more social. So 55% of the women surveyed who have burnout symptoms, 55% of those women use talking to others as a way to cope versus 39% of men. Men, however, are more likely to exercise, with 55% of men who reported burnout symptoms stating that they coped with burnout by exercising versus 39% of the women. Women, not surprisingly, are more likely to indulge in junk food. So 39% of women versus 27% of men. And in terms of sleeping, in order to deal with the symptoms of burnout, 46% of women are more likely to use this as a coping mechanism versus 38%. Now, in terms of who seeks help for burnout, women are more likely to seek help than men. 31% of women who report burnout state that they have sought help or plan to seek help in the near future regarding their symptoms versus 24%. Now, burnout also, this also varies based on specialty, with psychiatrists, not surprisingly, more likely to seek help for their burnout symptoms than people of any other specialty. Now, does where you work have anything to do in terms of whether or not you seek help or not? And it actually does, because physicians who work in academic organizations, who work with research, military or government organizations are more likely to report that their workplace offers programs designed to help with physician burnout. Now, let's talk about some characteristics of physicians who are not burned out. And some of the physicians who are not burned out reported in this survey that they exercise, that their jobs have autonomy and flexibility, which is huge, that they have a sense of accomplishment with what they do. They have supportive family, friends, and colleagues. And once again, this is very huge. And this is where I think social media has really served a good purpose, because like I said, there's so many Facebook groups out there for physicians in which you can really find a community of like-minded physicians. Physicians who are not burned out actually, report liking their patients a whole lot. And, interpersonal interactions are a huge source of joy, or could be a huge source of stress. So if you really enjoy the people you work with, that's more likely to decrease your chances of suffering burnout. A lot of people who report not being burnt out work in a good environment. I know of an OBGYN doctor, a woman doctor who just had a baby a couple of months ago, and her office staff is so supportive that they insist that she brings her baby to work with her every day, and they watch her baby while she does her work. And that's just amazing at how much they love this doctor and love her child. I have, other stories about doctors who work in offices that have just been so wonderful and so amazing to them and supportive of them in times of crisis. So working in a good environment really helps physicians to not be burned out. Another characteristic of physicians who are not burned out are physicians who work part-time or who work locums. Yay, locums. I do locums for a reason. And one of the reasons being was that I did get burned out as a full-time critical care physician, a full-time employed critical care physician. I mean, it burnt me out, and I was like, I've got to find something different. I chose to do locums because I have autonomy, I have flexibility, I have control over my life and control over my work schedule. And most of the doctors who do locums are quite happy with the way they do them. So, that falls right in line with the results of this survey. Other characteristics of physicians who are not burned out are people who are able to balance home life and work life. So the top 3 causes of burnout, the contributing factors are job, finances, and family. So if you can find a way to mesh those 3 and to balance those 3, that's going to be greatly decrease your chances and risk of becoming burnt out. Now, so some advice in this survey from physicians who are not burned out. First of all, they just recommended that you kind of take the time to count your blessings, and define what you can be grateful for every day. And I know that might seem as advice that's not great, because when you're in the throes of some pretty severe burnout, you really don't feel like doing that. But for doctors who say they're not burned out, they take time to count their blessings and go through their day with gratitude. One of the other pieces of advice in this Medscape survey from physicians who are not burned out, they recommend that you don't watch the news or watch very little of it. And I kind of tend to agree with that. The news is so depressing. There's never any good news. I watch enough just to figure out the major events going on during the day, but I have to decrease and limit the intake of negative stuff that I'm exposed to. Don't take work home. And this is huge, because one of the major causes of physician burnout is long work hours. So for my doctors who have to take, an extra hour or hour and a half at the end of the day to complete their paperwork, these physicians recommend that you do it at work. Do not bring work home, and so that when you are home, you are home. That's one of the reasons why I like being an intensivist. I work 12-hour shifts. When I'm home, I'm home. And these physicians who are not burnt out, who also responded to this survey, basically said that, things are kind of tough. And, it seems like, the pendulum is swinging the other way in terms of everybody else being in control of medicine. And it seems like physicians have lost control. But we have to kind of stay in and fight the good fight, because we've got to regain control of the process, because physicians are truly the ones who are putting patients first. So we got to regain control of the process. And, I kind of believe that in order to prevent burnout or to treat your own burnout, you've got to be happy. And what do I mean by that? You've got to figure out what it is that is making you unhappy and what it is you need to do to be happy. And we can maybe kind of talk about these things later, in terms of talking about what kind of things that you can change in terms of your work, in terms of your job, in terms of your schedule, in terms of flexibility, autonomy, changes that you can make to make life and work integrate more seamlessly. Because those are some changes that are going to have to be made so that you can, continue to be happy and satisfied in your jobs as a physician. So I noticed that we got a couple of people that jumped on the broadcast recently, and I do appreciate you being here. If you don't mind taking a couple of minutes just to comment, let me know who you are and where you're watching me from. I kind of went through a lot of things here. What I am going to do is I'm going to take some time to kind of go back through some of the data kind of quickly. But meanwhile, I would like to hear what some of you guys have to say. If you don't mind putting some comments in the comment section, I would like this to kind of be a discussion. But, like I said, basically, 42% of all physicians are burnout, and 15% report some clinical depression. The highest rates of burnout are in ICU medicine, critical care medicine, neurology, family practice, OBGYN, emergency medicine, and radiology. And the lowest rates of burnout are in plastic surgery, derm, path, and opto. So more women are burnt out than men, 48% versus 38%. Burnout varies by age, with it peaking with the physicians who are between the ages of 45 and 54 years old. Rates of burnout are equal between employed and self-employed physicians. The three main contributing factors to burnout are job, family, and finances. And burnout affects all types of things like interactions with your patients, interactions with your staff and your peers. Maybe some of your clinical performance is a little affected by burnout as well too. Main causes of burnout: too many bureaucratic tasks, too many hours at work, lack of respect from your bosses and administration and patients and colleagues. The EHR system, I cannot tell you how many people just want to pick their computers up and just throw them away because EHR systems add to your workload. They don't make it easier. Lack of control and autonomy, emphasis of profits over patients. Some of the things that can help with burnout: increased financial compensation for the stuff that we have been doing that we don't necessarily get paid for. More manageable schedule, less regulation, increased autonomy, more manageable patient loads, increased respect, increased flexibility in scheduling, and a return to putting patients first. Some of the coping mechanisms that physicians use: exercising, talking with others, sleeping, music, food, junk food. Although, the last three, the food and the junk food, not necessarily the best coping mechanisms, but it is what it is. Coping mechanisms do vary by gender because women are more likely to seek help. More women are more likely to talk about their burnout and their depression, whereas men are more likely to exercise. Women are more likely to engage in junk food, and women are more likely to sleep as a way to treat their burnout or to deal with the signs and the symptoms of burnout. Women are more likely to seek help than men, and psychiatrists are more likely to seek help for their burnout symptoms than other physicians. In terms of workplace burnout programs, physicians who work in academics, research, military, and government positions and government organizations, about 61% of these physicians report having access to a workplace wellness program that treats or is designed to prevent burnout. And some characteristics of physicians who report not being burnt out: these are physicians who exercise, experience autonomy and some flexibility in their jobs, have a sense of accomplishment, have a good support group, they like their patients, they work in a good environment. Some of them work part-time, some work locums, able to balance life and work. And some of the advice in terms of not being burnt out is to not take work home, try to regain control of the process, and to figure out what it is you need to do and the changes that you need to make in order to make it work for you. So for those of you who are interested in doing locums, please download your free copy of my locums ebook. And like I said, locums is near and dear to my heart because as a critical care physician, I was burnt out. I needed increased flexibility. I needed control. I needed to regain some autonomy over my life. And that is why locums works for me. So for those of you who are interested, please go to bit.ly Dr. Stephanie Locums ebook and download your free copy of my locums ebook. This ebook is just a good summary of what locums is and how to get started in doing locums. Now, just for you guys tonight, in celebration of National Women Physicians Day, I have a new product, and it is the guide to physician burnout. This is an ebook that is a series of, some short essays that kind of talks about the causes of burnout and some quick and practical things you can do to cope with burnout as well too. So go to this link right here, bit.ly burnout ebook, and download your free copy today. I really do thank you all for joining me as we celebrate National Women Physicians Day. We have had a series of series of Facebook Lives talking about issues involving women in medicine. We're going to do 2 more Facebook Lives in celebration of National Women Physicians Day. So please join me here at 8 p.m. Eastern, 7 p.m. Central. And I do appreciate you spending part of your Saturday evening with me. Thanks, and bye-bye.